All right, Carrie, if we're ready, we'll get started. I know that you said you were.
Ready to go when you are, Madam Chair.
All right. Thanks, Carrie. I'm going to get started then. Good afternoon, everyone. My name is Anisra Saibi-George, and I'm chair of the Boston City Council's Committee on Education. In accordance with Governor Baker's March 12, 2020 executive order, modifying certain requirements of the open meeting law and relieving public bodies of certain requirements, the City Council will be conducting this hearing virtually. This enables the City Council to carry out its responsibilities while adhering to public health recommendations and ensuring public access to its deliberations through adequate alternative means. Today's hearing is on docket 0166, order for a hearing regarding the implementation of a BPS ready plan. This public hearing is being recorded and live streamed on boston.gov/city-council-TV. It will also be rebroadcast at a later date on Comcast 8, RCN 82, and Verizon 1964. We will take public testimony at the end of this hearing. If you wish to testify via video conference, please email shane.pack@boston.gov to sign up. That's shane.pac@boston.gov. When you are called, please state your name and affiliation or residence and limit your comments to no more than 2 minutes to ensure that all comments can be heard. You may also submit written testimony for the record by emailing ccc.education@boston.gov. Today, I'm joined by a number of our colleagues, and more may join throughout the hearing today. First, in order of arrival, we have Councillor Bach, Councillor Campbell, Councillor Arroyo, and Councillor Braden. I'll briefly introduce my panelists, or the panelists that are joining us today, and give colleagues an opportunity for opening remarks. I just missed my, we are joined today by the Superintendent of the Boston Public Schools, Dr. Brenda Cassellius, Yenny Lobo-Lopes, Senior Director of Health Services, Teresa Neff-Webster, who is the Deputy Chief of Operations, Delaverne Stanilas, who is the Transportation Director for the Boston Public Schools, Laura Benavides, who's the Executive Director of Food and Nutrition Services, and Mark Racine, who's the Chief Information Officer. We also have a number of other BPS administrators who are available to answer questions as needed. We also are joined today by President Jessica Tang of the Boston Teachers Union, Dana Griswold, who's a special education teacher at the Blackstone Elementary School, Marta Bausimer, who is a nurse at Boston Green Academy, and Fabienne Alcien, who is a parent at the Elliott K-8 Innovation School. We'll hear from both panels before we move to question and answer, then public testimony due to our situation here today. I'd like to open it up to colleagues for comment if anyone would like to give a brief opening statement. I'll start with Councillor Bach.
Thank you, Councillor Saibi-George. I know we've got two panels, so I'll be brief. Just want to thank the BPS team. Thank you for calling this hearing. I think we're all really eager to hear about the plan, to get our students safely back into schools. I'm really grateful to the district in particular for the work on vaccinating our teachers and staff, and excited to be at this juncture having this conversation, because I think, we hear all the time about, we've got many students for whom remote learning is working, and we've just heard this great news about graduation rates. And so I want to congratulate the district on that. But we also hear from the students and families for whom being remote has been a real challenge. And so I'm excited to hear the plans today, and grateful again to you for calling this.
Thank you, Councillor Bach. Councillor Campbell. Councillor Campbell, a brief opening statement. We'll go to Councillor Arroyo. Oh, there she is. There she is.
Sorry,
okay.
I'm trying to transition from my phone to my computer, which died. But thank you, Councillor Saibi-George, for hosting the hearing. Thank you to all of the panelists for being here. I'll echo what Councillor Bach has said, grateful for the work of the district in terms of getting our teachers vaccinated, as well as the union for their efforts as well. Obviously, this is something that comes up every single day, whether it's on a Zoom call or email or a call from a constituent, is parents who, of course, want the option to send their kids back who are not doing well in the remote learning experience. And so I am happy that we have moved this conversation forward with dates, timeline for implementation. Want to continue to get updates and see where we are with that and realizing that. so that we can actually, of course, get back to our parents on this. So thank you to everyone for their work. Looking forward to this hearing. Thank you, Councilor Asabi-George.
Thank you, Councilor Campbell. Councilor Arroyo.
Thank you, Madam Chair. I'll be short. I just want to apologize that I can't have my camera on during this hearing. I'm dealing with a migraine, so the screen is helpful when it's off. In terms of what we're here for today, this is obviously a key issue. I want to take a moment to just say thank you to the district and to BTU and our teachers for the work that they've been doing during this crisis. My hope is that we're now on the back end of what we've had to deal with, and we're now looking at ways in which we can get children back into school in a healthy, safe way. And so I'm excited about this because clearly our children, our parents, and our teachers have missed the ability to teach in class. And so I want to just congratulate both of you, the teachers, as well as the district, for the work that we've done to ensure, the highest graduation rates, as Kenzie Bach said, Councilor Bach said. And so thank you to both of you, and thank you for today.
Thank you, Councilor Arroyo. Councilor Braden, brief opening statement.
Thank you, Madam Chair. I'll keep it very brief. I want to echo my gratitude to be able to have this conversation today. It's been a long time in the making. Thank you to our Boston Public Schools and to all our teachers and staff for the incredible work that they've done to support our students over this past year under very trying circumstances. And I think we're turning a corner, and we're in a very hopeful place right now. And I'm encouraged and excited to learn more about the plans this afternoon. Thank you.
Thank you, Councilor Braden, and thank you all for being here with us today and continuing this conversation on reopening of the Boston Public Schools during the COVID-19 pandemic. This is the third time we've held a hearing on the reopening of the Boston Public Schools since the beginning of COVID-19. In our last hearing, we were facing a winter surge and had yet to see variants of the virus emerge. Today, we have passed the anniversary of the first day BPS closed its doors for the first time. In that year, we've had more than 250 COVID cases in our district. The overwhelming majority of those infected were our staff members. The pandemic continues to show us what is and what isn't working in our schools. What is clear to everyone is that our students are impacted the most. We have generations of learners whose lives have been upended during some of their most formative years. I have said since the beginning of the pandemic that we have had to work towards getting our students back into school and back into school safely. A year ago, we didn't really understand the pandemic and what it would mean to reach that goal. We have a much better understanding now, and I am certain that we must learn from this year and thoughtfully plan for getting our students back to school. I am eager to hear the results of the BPS Family Survey. I am hopeful that DESE will grant the district's waiver to delay full in-person learning and that reopening for after-school vacation. Although I'm hopeful there might be opportunities to return some of our younger schools to full-time in-person sooner. We do know that we need time to ensure that our schools are physically ready, that our teachers who are able to be in person have the resources and time to appropriately plan for in-person learning. Although I will note that many of our teachers have been in our classrooms across our district teaching in person, especially our highest need students. And as our younger grade students have returned over these last few weeks and several months. We also know that our nurses need to have the resources to keep everyone safe, and our families have time to readjust yet again. We must continue to openly talk about the existing issues in our district and work together with the same goal in mind: safe in-person learning for as many students as possible, while keeping the risk to our staff and families as low as possible. I want this to be the last hearing on reopening, and I'm hopeful that we will have a realistic and creative plan in place for in-person learning this school year, and that we're also working to make sure we have plans in place for the summer and to kick off the next school year fully. Thanks to all the panelists who are participating in today's hearing. I'm going to now turn it over to the Superintendent of Schools, Dr. Cassellius. Thank you for joining us.
Thank you. Good afternoon, and thank you, Chair Asabi-George, members of the Education Committee, counselors, members of the Boston Teachers Union panel, President Tang, and all who are joining us here this afternoon for this conversation. We are just really excited to be here today. But first, before I get started, I want to congratulate new Secretary Walsh for his incredible accomplishment of being appointed secretary under Joe Biden. He's going to be our U.S. Secretary of Labor. We spent the past 3 weeks going to schools and visiting, saying goodbyes, and having kiddos give trinkets and tokens of their appreciation for his tremendous support of the schools. And of course, I also want to say hello and welcome to Mayor Janey on her historic appointment now to being the first woman mayor and the first woman of color to serve in the history of Boston. What an incredible moment this is in our history. And so just was able to go to the Edwards School with her today, which was her school that she went to and was bused to during the time of desegregation efforts in the 70s. And so just really excited about this new opportunity with her to be able to lead for the school. So I want to congratulate them both. I also want to thank the mayor's cabinet who just helped us incredibly during this time of COVID this past year. Chief Brophy and Chief Martinez in particular really stepped up and helped us, and from food and housing, and Sheila Dillon. Just amazing coordinated effort and all hands on deck. And I want to thank you, counselors, for your support in that, the funding that you provided, the early work that President Tang and the BTU did prior to my arrival to realize the importance of having a nurse in every school really did make a difference for how we were able to respond to this pandemic. And we just want to thank our nurses for being there for us this entire time. As we look forward to this opening, I wanted to just take a quick look back over the past year and everything that we've done. I can't believe it's already been a year that we've been at this. It's just an amazing team that I get to work with at BPS. And after the pandemic, we all shifted just overnight and began to quickly assemble and feed our kids. We served about, I think we're almost near 4.6 or 4.7 million meals that we've been able to serve. We were able to quickly pivot and get packets out for what we thought was going to be supplemental learning at the time. It was about 6 weeks that we thought we would be closed. Little did we know that we would be closed the remainder of the school year and into the full year that we are now, before we would be fully open for K-8 for those families that were choosing it. It was an incredible challenge for us, but we really did pull together as a city. The philanthropic community came through with the Resiliency Fund, which really helped us be able to get out our computers right away. We pivoted once we were in May, got at that time we got 20,000 Chromebooks out. And now we're about 55,000 Chromebooks, headphones to students who everyone has that needed one. 6,000 Wi-Fi had hotspots. We've been able to provide Comcast low cost or free. And we've put in video equipment in our classrooms for our teachers that they're still getting used to, and new software and new tools for them to teach in the remote environment, which they have just picked up so incredible. And I can't thank our teachers enough for their resiliency and their ability to be creative and share across classrooms and across schools to meet students' needs. So these new tools really did help them meet the challenge. We've provided thousands of vouchers to our families for the Wi-Fi. As I said, we've also worked with housing to provide 1,000 vouchers to our BPS students who are homeless. We've housed now, I think, 600 of those families, and we have about 400 left to be able to house. Really excited about that work with Sheila Dillon. We've provided nearly 20 schools who had 250,000 meals with fresh meals that they've been producing right on site. We just started that a few months ago, and we plan to expand this fresh meals across all of the district over the next year and a half. We secured 14,000 connections to 3,600 students for behavioral health counseling. I know, Madam Chair, that is a huge part that you really believe in, with the social workers and the support given to our youth around mental health services. We initiated community roundtables, equity roundtables, both at the district and at the school level, so that we could hear from families and advocates and city residents. This was a huge, huge step forward for us, especially as George Floyd was murdered, to be able to talk about race and equity and the intersection with our school and the systemic barriers that we had. And we're really leaning into this work as a school district to become anti-racist and anti-biased in all that we do, with a really clear lens. Getting to the operational side and our facilities, which you know are old, we repaired 7,000 windows. We delivered 7,500 air purifiers. We updated all of our air filters to MERV 13, or the highest filter that a school could take in the HVAC schools that we had. We did air quality testing. We repaired 7,000 windows, and we continue to repair windows as needed. We lifted up vaccine clinics for our school staff, our bus drivers. We really took a focus with our bus drivers, our monitors. I want to thank Megan Costello for her work with that, and the city and Chief Martinez for rallying up those vaccines for us. And I also want to thank the BTU, who was going to help us get a second clinic, but because our teachers were signing up and getting their vaccines elsewhere, we didn't need that second vaccine site. But I want to thank them for their generosity and partnership in getting that. We have about 88% of our workforce right now reporting that they've received at least one dose of the vaccine so far. We launched a data dashboard for transparency on confirmed positive student cases within the BPS. We also are monitoring our classroom temperatures as they shift and change in the springtime. We did air quality testing in collaboration with the BTU, and they were able to come with us on a number of those visits and monitor and support us in that process. We are now testing our students and have our staff being tested at 53 of our schools. And we're testing at all of our 125 schools across the district for our students to do pool testing. And we're doing the individual testing for adults. And now we have successfully welcomed back in hybrid all of our students starting March 1st. We had our high in-person priority students, as you know, at 32 of our schools, and then expanded to all 125 schools for all of our hybrids or high in-person priority students February 1st. And then March 1st started bringing back our K0 March 15th. Started with 4th through 8th grade, and now we have all of our K8 back, looking forward toward our high schools being back on March 29th. So we're hoping that we're going to end on a strong note here. We've submitted our waiver to DESE, anticipate getting an answer in the next day or so about how we're getting ready to reopen for 5 days in person. We plan on that being on right after we return from spring break, so that parents can start planning and getting their bus routes. And we're here today to talk to you about, how we're going to return strong, recover, and reimagine as our framework to really lay out a strong and ambitious plan for our pivot here to what will become our more new normal. But it's truly going to take all of us working together, as it did this past year, to return strong. And so I want to thank our families as well, who really pitched in this year to help our teachers and to help our school leaders, and really all of us keep our kids safe, keep each other safe, and keep all of our students engaged. I know it wasn't easy for our parents to balance work schedules, to balance activities, and to balance school at the same time at home. So big thanks to our parents for pitching in too. We know that this year, some of our students may experience some learning loss, but some of our students did actually do well in a remote environment too. So we will be assessing and using our teacher assessments, our interim assessments, and our formative assessments to better look at how our students are doing, so that we can plan better for them in the fall. And then also planning for a really strong summer school option. We'll be working with Boston After School and Beyond, who are our partners, to offer summer school. We believe that we will have about 27,000 students in summer school, in either enrichment or in one of our schools or with a partner during this summer. I think it's a really important summer that our students are engaged in these enrichment opportunities, in job opportunities, in early college opportunities or vocational opportunities. We have a lot of different things that families can choose up for, and pretty soon we'll have our website up called Summer Stuff. So look to the BPS website to get more information about summer school. I know, Madam Chair, you wanted to know a little bit about the survey. To date, we've heard from, I think it is around 35,700 students, and 81% of the students are remaining in their current model. So we didn't see a lot of shift over from parents who are choosing remote to hybrid, or hybrid to remote. If you chose hybrid for 2 days, then you are pretty much saying you want to be there 5 days. So we're seeing that pretty stable for our families, and we've had about 70% of our families return that survey. So we think we have everything in place to have a safe and a smooth opening. And I have the whole team here who is going to be speaking today about all of the, in particular, all of the things that we've done in preparation for a smooth start later this April. And then also begin to ask your questions. So I thank you for your time tonight, and I'll turn it over to my team, who has been outstanding. I know you introduced them earlier, so I won't reintroduce them. But I'm pretty proud of these folks. They have been in there with very little time off, day in and day out, with shifting and changing science, shifting and changing guidance, shifting and changing timelines. And they've really done it in a way that has been collaborative and thorough. And so I can't thank them enough. So with that, I'll turn it back over to you, Madam Chair, for the presentation, and then I'll be here for questions with my team.
Thank you, Superintendent. Who will be leading this presentation?
I believe Megan Costello is going to help us facilitate the
Perfect.
presentation.
Thank you very much. The screen is yours. Thanks, Megan.
Thanks so much, Madam Chair and Superintendent, and all the counselors that are here today. We have a number of folks, as the Superintendent said, that will be presenting today. So I am going to turn it over to our Deputy Director of Operations.
Good afternoon, everyone. Thank you for having me. I'll be focusing an update on facilities, specifically projects that we've completed, where we are today, and future projects for the summer. In regards to our windows, of the 27,000 windows in the district, all were audited. The result was that 5,000 windows were in need of cleaning to be operable, and a further 7,000 were in need of repair to be operable. All cleaning and repairs are completed. This project started the summer of 2020 and was completed in February of 2021. In regards to air quality testing, BPS, with the support of BPHC, did air quality testing both in the fall and continues to do air quality testing that mostly monitors things like mold and what is the air quality in the actual rooms. In addition to that testing, we have contracted with an external vendor to conduct air exchange testing in our schools. This vendor followed the guidance outlined by the Harvard T.H. Chan School of Public Health in their document 5 Steps Guide to Checking Ventilation Rates in Their Classrooms. The air quality testing results are currently public on our website, and the air exchange results will also be made public momentarily in about a day or two. We're just kind of making sure we clean up the reports, and they are digestible for the public. In regards to MERV 13, as the superintendent mentioned, all of the buildings that are capable of being upgraded to MERV 13 filters have been upgraded to this date, and we did procure 7,500 air purifiers of the Medify 40 unit in particular, and we have distributed those units across the district. Information regarding this unit is open to the public on our website as well. And when we look to what we are doing today, the district created a sanitation protocol based on CDC guidance and guidelines from CDC and guidance from the Boston Public Health Commission. We continue to use those protocols on a daily basis. Additionally, every school building has at least one Gen-On mister that custodians use twice a week in the evenings. We have a system in place where school leaders can request additional air purifiers based on space needs, and those air purifiers are delivered on a daily basis to schools as needed. We also have a strong system in place in regards to requesting additional PPE in the schools. These are reviewed weekly and delivered weekly. We are monitoring our PPE stockpile and ordering as needed. When we look towards our future, we have a contract in place for the installation in every room, in rooms in our schools, to do indoor air quality sensoring, which will allow for real-time reading of the air exchange rates in our buildings. We are also moving into our water project, which, thanks to the investment from the capital funds from the city and a grant from the Environmental Protection Agency, we will be launching a multi-year drinking water initiative, which will install and test approximately 1,400 new filtered bottled refill stations across the district and improve equitable and access to drinking water for all the BPS school communities. And finally, we are moving into our phase 2 of our bathroom project, where 5 schools and a total of 86 toilet rooms will be under renovation this summer and be ready for use in the fall. That's my update for facilities, and I will transfer to transportation.
Thank you, Teresa.
We're ready for you, Del, when you're ready.
Yep, I'm ready, sorry. When the pandemic hit over a year ago, the transportation team pivoted quickly to ensure the safety of students and employees. DESE and state guidelines have significantly impacted service provisions at our bus yards and on buses. This has required our team to improve our flexibility and responsiveness. The transportation team, in collaboration with our vendor, our contractor TransDev, has implemented significant measures to ensure student and staff safety. Approximately 300 employees move through each of our 3 bus yards each day. Due to new social distancing guidelines, the transportation vendor reconfigured the bus yard to ensure employee safety. All internal operations for drivers and monitors have moved outdoors in tents with tent heaters for inclement weather. Vendors were hired to disinfect buses and all internal high-touch areas twice daily. In addition to vendors disinfecting buses, disinfectant machines were purchased for use on buses and around the bus yards. PPE gear continues to be ready and available for all employees in the yards and on buses for students. Temperature-taking devices were installed and additional staff added to support safety protocols, cleaning, and symptom check stations. DESE guidelines reduce rider capacity on buses to around 35% of normal capacity. We've added signage to bus seats to ensure social distancing on all of our buses. The district worked in collaboration with BPHC to ensure COVID testing is available on Tuesdays for all transportation employees and contractors. The district also held information sessions at bus yards for employees about COVID vaccines, and transportation employees and the contractor employees were prioritized for vaccines. It is important to note that DESE has recently modified its social distancing guidelines for buses. The district continues to work closely with BPHC on the safest ways to adopt these new guidelines. Next slide. The transportation team prioritized flexibility and the ability to quickly respond to changing reopening timelines throughout this school year. The transportation team routed all students eligible for a bus and who did not opt out of a bus or in-person learning regardless of their in-person start date. This allowed for full bus routes and individual stops to be quickly turned on and off throughout the year based on the district's reopening plans. The complexity of responding effectively to the pandemic has not been limited to BPS. We serve over 100 non-BPS schools, many of which serve special education and other particularly high-need students. Each of these schools has their own schedules and reopening timelines, and many have hybrid schedules that do not align with BPS. This underscores the need to prioritize flexibility in our routing and operations in order to accommodate student schedules, even more than in past years. We have also increased and expanded our communication outreach. We have increased our ability to engage families and better support families and schools in real time. Finally, on March 1st, when BPS reopened its doors for our K0 through 3rd grade students, our on-time performance hit 95% across all 3 tiers. The transportation team understands that our work is by no means done. Providing access to safe, equitable, on-time transportation to all students in the city of Boston is of utmost importance. However, we have been doing the critical and hard work of building a stronger foundation for transportation services. Our team continues to work diligently in collaboration with our district leadership team on how we can adopt the new DESE guidelines. And as always, on-time performance and student and employee safety remains our top priority. Thank you.
Thank you, Del. My name is Jenny Lobo-Lopes, and I'll briefly go over health services. The Boston Public Schools Health Services team has been instrumental in the reopening plans for all BPS schools, beginning with the implementation of the health services reopening plan, including 2 versions, which is widely used by BPS staff. Protocols including, but not limited to, symptomatic student assessment and action steps, positive student staff procedures, contact tracing protocols, and contact tracing of identified positive BPS cases of students and staff in collaboration with Boston Public Health Commission began as a part of the BPS reopening plans and continues successfully with communication to parents and families and BPS staff with any identified positive case and close contact tracing. Health Services reports weekly to Massachusetts DESE all positive cases and works closely with Mass DPH as needed. As part of a continued effort to enhance the capabilities of health services to provide a safe, equitable, and healthy environment for all BPS students, the hiring of a new senior director and assistant director occurred in January of 2021. BPHC, in collaboration with health services vaccination efforts for our health personnel in phase 1, were able to assist school nurses with obtaining COVID-19 vaccinations. And to date, there have been 118 nurses vaccinated. And this is based on voluntary reporting from health personnel staff. BPS school nurses played and continue to have a pivotal role in the reopening of schools. School nurses were actively supporting students and families and staff in person at the 32 open schools and remotely with ongoing communications with high needs and at-risk students. The nurses were responsible for the creation of the virtual health office to support students and families remotely, involvement in student support teams, participation in IEP meetings, and nurses play a current and active role in student pool testing and assisting with weekly COVID staff testing. Next slide, please. Continued efforts by BPS and health services to maintain a safe and healthy environment for students and staff through weekly surveillance COVID-19 testing. BPS staff continue with weekly surveillance testing, and newly implemented on March 8th is the student pool testing as a layering mitigation strategy to reduce the risk of COVID-19 transmission within Boston Public Schools. BPS is actively participating in the Mass DESE student pool testing program with BinaxNOW reflex follow-up testing. Students who have consented to participate in the pool testing are tested weekly in school. To date, there are 5,100 consents. Consents were provided electronically and in paper format to all BPS families in their native language to include 10 different languages. Pool testing to date, there have been 1,474 total tests conducted from March start date to now. Response to follow-up testing to date is 81, and positive pools are 15 total positive pools. Positive pool cases from the pool testing, we've had 4 confirmed individuals out of 81 students in positive pools. Currently, Health Services has conducted 381 plus contact tracing with identified positive individuals. And this number does not include the volume or communication of contacting all close contacts. Contact tracing protocols have been updated on the BPS website to provide ongoing information and clarification on contact tracing protocols. A video on student pool testing is also available on the BPS website. Health Services continued support to school communities with increased nursing staff, including the addition of school nurses in all BPS schools. Of 148 FTE school-based nurses, 7 FTEs for centrally deployed coverage nurses, 4 FTEs for centrally based school nurses, and 6 FTEs for health paraprofessionals. Next slide, please. Thank you. Ongoing nursing professional development. Health Services provided a 3-day professional development program to all BPS nurses regarding COVID and other educational opportunities, including BPS and Boston Children's Hospital Group, a COVID-19 school nurse training for the return to school. It's a collaboration between Health Services and Children's Hospital Global Health Initiative team. They have committed to working with our nurses for a year, and they conduct weekly small group meetings by age group of student population, including team building, leadership, COVID, self-care, and staff relations. Health Services has provided and continues to provide trainings on COVID-19 to all BPS school nurses. There are multiple and ongoing, including but not limited to the COVID Institute, return to school preparation COVID-19, student pool testing trainings, which included 9 sessions, including question and answer sessions as needed. On-site testing support was also provided to the 78 schools and on an as-needed basis for student pool testing. We have weekly meetings with all BPS school nurses and Health Services, weekly orientation meeting for new BPS school nurses, and weekly Health Services newsletters. We continue to review our state and federal guidelines to update our protocols and our efforts to expand contact tracing and COVID-19 testing. We welcome any feedback on how to increase participation in student pool testing. Thank you, and Megan.
Thanks so much, Jenny. Good afternoon, counselors. Great to be with you. I want to provide you with a brief update as to where we are with vaccines. Obviously, vaccines is the hope that many of us have really been holding on to. So it's been a delight to come into BPS and to be able to work on this project. I also want to give a shout out to my colleague, Jerlene John, who's the former headmaster, and Mark Racine, who you'll hear from in just a moment. It was really this trio that worked very hard along with a lot of other folks at BPS to make vaccines possible, including the superintendent mentioned in her remarks that the BTU was willing to use their site as a location as well if needed. And we're delighted to report that because of not only the vaccine clinic that BPS was able to provide at the Gallivan Community Center, but also a number of partners, local hospitals, community health centers. We've been able to, through our website that Mark and his team created, we've been able to offer over 5,000 slots for our workforce through different community health centers and local pharmacies and places like that. And that's in addition to the 1,484 vaccines that we've been able to provide for our workforce at our own clinic. I'm actually at the clinic right now, obviously in a side room, but it's really been incredible to see the work that the nurses and the pharmacists and everybody here has been able to do, and it's been a great and smooth process. So we've been delighted that we've been able to lift up this clinic specifically for our workforce. It was really the superintendent's leadership, who said to us back in January, once vaccines are here, I want these, available to our folks. And we've also been really intentional about our outreach. BPS has 10,000 employees. We have a number of contractors as well, including our bus drivers and our bus monitors. And so we've really had to be intentional about thinking about our workforce. And who needs access to these vaccines and who may need support that might not be, at a computer all day or have as much familiarity, with technology and access to the internet. So we scheduled, we had a phone number that folks could call. We actually sent out employees to the bus yards to actually schedule bus drivers and bus monitors. And we're continuing to work with the Boston Public Health Commission to do that intentional outreach in other ways as well. So with that, I'm going to turn it over to my colleague, Mark Racine from Technology.
Good afternoon. So we have presented to you before, and as you've seen our numbers, you know that we've done a lot of distributions with Chromebooks and hotspots. At this time, now we're pivoting towards reopening and thinking about what are the changes that we need to make in order to keep those up and running. So the easy part has been the distribution of Chromebooks. The hard part now is the maintenance and care of them. So we're really excited this year. We brought back a school technology coordinator program where each school has a stipended person in their building who is helping us and being the point of contact with students and families. The schools will coordinate the repairs and those devices will then go to our team for either repair or replacement. This could not have been possible without our school staff who are serving as the point of contact. The majority of them who have existing jobs, either teaching or being a paraprofessional. And so this is above and beyond their day-to-day job. But these 55,000 Chromebooks that we've distributed and headphones would not be working if it weren't for the folks at the school. So a huge thank you to that group. As you know, we've also distributed a number of hotspots as well as Comcast vouchers. We were able to do so with a combination of funds from the Resiliency Fund. The Department of Education provided us with a grant, as well as another external grant from the 1 Million Project. I wanted to point out that the voucher utilization is low. Despite that, we are still seeing upwards of 99% of our students logging in on a day-to-day basis through a high-speed or broadband connection. This is a very, very important number for us because even though we are distributing vouchers and distributing hotspots, we're seeing utilization very low. The impact is still there. We're still seeing students able to log in. We're still seeing families that did not have broadband prior to COVID actually being able to get connected and get logged into class. So this is still an ongoing challenge, and there are still many families who are mobile or finding new homes to live depending on the circumstances. So this is an ongoing work, but at the same time, we're very proud that many of our families were able to keep up their internet connection throughout the pandemic, or at least get connected to a service, either from some of the programs that were offered through the government, through private companies, or some of the supports that we've been able to provide. We're also very excited the federal government has announced the Emergency Broadband Relief Act, which will provide families with upwards of $50 a month off of their home internet bill. So even families who were not eligible or did not take a hotspot or a voucher will still be able to see the benefits of that program. And that should be coming in the next few weeks from the FCC. We've also distributed 3,500 classroom cameras. These are, think of it as a speaker bar with a wide angle lens, a large speaker, and a microphone array. Some of the comments from our teachers is that this has been able to allow them to unhook from the laptop a little bit, take a step back and begin to get back into your normal teaching practices, using the board, using your classroom as your physical classroom, and the camera allows you to get a little bit farther back from the computer, although you're still managing a computer and Zoom at the same time. So the classroom cameras have been a huge help for our teachers, and we are still working with teachers who may need a little bit more help in learning how to use it. I will admit my wife is a classroom teacher in Boston, and she's still very apprehensive of using the camera. So I still have some work to do with a few teachers. And then finally, we've done a lot of work on our network, and that's obviously in anticipation of reopening. Just last night, we were able to double the capacity of our network in anticipation of hybrid learning and students returning. We've completed a number of school network upgrades, all the way from a complete overhaul of the network to adding additional wireless access points to various classrooms. And then at the same time, we're continuing to troubleshoot various network issues. As more and more students return, there are some expected problems and there are some unexpected problems. We're doing our best to troubleshoot those, because obviously the internet has been critical to our classrooms before, but now more than ever, as our students who are remote log into their physical classroom, our school network is absolutely critical. And then one statistic, which I'm really excited, I always love to look at the Zoom numbers. Oh, I just missed, there you go. We have hosted in the last 12 months since the school closure, 1.3 million Zoom meetings, totaling 800,000 days of virtual instruction. So it's an enormous number to see, and it's also a testament to how hard our teachers are working from home. So it's really exciting to see, and we're going to continue to host Zoom meetings moving forward.
Mark,
So with that, I want to actually talk about. Oh,
hey, Mark,
yes.
who's your biggest Zoom user?
I think that was a planted question. So we have there is the number one. I can't remember the number one, but the number two is actually the superintendent scheduler. So the person who is scheduling all of Dr. Caselius's meetings is our number two frequent Zoom user. So that's a huge testament to both the work of our teachers as well as the superintendent. And then finally, with our attendance, we've got some basic information from our public dashboard. I definitely invite you to take a look at our public dashboard, because all of the graphs and data you can manipulate into looking at different subgroups. Our average daily attendance prior to the pandemic hovered between around 92 and 93%. Right now, our attendance is hovering around 90%. And as if you look at the graph down below, you can see that our high point is around 3rd, 4th, and 5th grade. And then it starts to tail off around K0, K1 grade levels, as well as junior and senior levels. This graph is a little bit hard to see on the screen, but it does break it down by in-person attendance, and that number is constantly changing. But at this point, we've had, I think, approximately 16 or 17,000 students who have at least attended one day in person, and that number is growing every day. With that, I'm going to turn it over to Laura, who has some numbers on food services.
Thank you, Mark. Thank you, Councillor Sabi George and the City Council for the opportunity to share some information and updates from Food and Nutrition Services. Before I do get started, I do want to share a special thank you to Superintendent Caselius for her constant support and lifting up of the work that our small but mighty team has done to accomplish in this great pandemic. With all of the things and the curveballs that get thrown at us, I think I'm very proud of the team that I've been able to have opportunity to lead, to pivot into what we've needed to do to provide services to children. What I always share with my team is that I did not need a pandemic to tell us we were essential. So we certainly appreciate the opportunity. I will be sharing, as we shared and talked before, Food and Nutrition Services, we did not stop working since our students left on the buildings of March 16th. We were able to regroup quickly to ensure our students would continue to have access to meals even during this pandemic. We've been through many challenges and changes within the year, but I assure you with confidence that our program has been there to serve our children and their families. Through collaboration within our district, transportation, OIIT, food facilities, safety services, we worked together and served almost 5 million meals under the COVID restrictions. At the rate that we're going, we'll probably hit the 5 million probably by the first week of April. Over 1.3 million of those meals were delivered to students in their homes. These were children that currently were approved for door-to-door transportation and were having hard times coming to our sites to come pick up meals. So we were able to deliver and work with our buses during April all the way until the end of June to deliver meals to the children and their siblings. And of course, through all of this process, we didn't do this alone. Almost 500 of our BPS food services staff were available and ready to work during even the restrictions of COVID to serve meals to our kids. We also worked with and had over 9,000 volunteer hours logged with citizens of Boston, as well as over 2,000 hours of volunteers that were packing meals and delivering to families across the district. A lot of the coordination of the hours and the plans with the staff to provide access to meals included daily meetings with our city partners, such as the Office of Food Access, YMCA, Greater Boston Food Bank, and to work with us to adjust locations to be able to provide meals to our children. And these offered us other opportunities to create partnerships that included providing over 40,000 grocery bags at 22 locations across the city every 2 weeks. When USDA food boxes became available, we've delivered about 11,000 of those. They're 30-pound boxes full of fresh produce and protein and dairy to our families. And they were going to our families that were receiving door-to-door meals because they couldn't have access to come pick up meals, groceries at our locations. As we continue to prepare for more students returning to schools, we are working with school administrators to ensure we create safe eating places for students. This includes our cafeteria, classroom, outdoor spaces. We want to make sure we're following through the CDC guidelines to ensure that students are able to continue to experience a sense of normalcy when they're coming back to learn and eat in our schools. For families that choose remote learning, we will continue to have our super sites available. Locations will continue to be open Mondays and Thursdays from 10 a.m. to 6 p.m. Again, as part of our processes and our future plans, we were excited to return to our normal meal practices in our kitchens. Our next steps are to increase the number of locations that are cooking from scratch on site, and also the expansion of the newly built cafeteria schools. By May 10th, all schools with kitchens will be cooking for all the students on site. By May 17th, we'll be opening 6 more My Way Cafe kitchens across the district. Those schools are the Blackstone, the Gardner, Baldwin, Channing, the Chittick, and the Hurley. And these are the locations that were constructed, 6 of the 20 locations that were constructed over the last summer. And we want to continue to make sure we're progressing in our options to our meals that we're providing to students. The next slide. Lastly, I'd like to provide some updates on some initiatives that have a positive impact on our students and community. As we have seen and heard from our current administration, food insecurity is a reality across the country and certainly exists in our community. Under the new Biden administration and the new USDA Secretary Vilsack, they are working with partners in child nutrition, including Boston Public Schools, on creating a structural change in our food system to confront hunger, strengthen equity, and increase access to meals. So the 2 key initiatives that are impacting us now in a positive way is that the current access to food funds under the pandemic EBT or the PEBT cards will continue for the rest of the school year. Additionally, starting in March, families will receive an extra 15% of those funds to utilize at grocery stores, including online delivery services, to supplement the meals students may have missed by not being in schools. To date, over $65 million have been allocated to our BPS families in these food funds. Additionally, the USDA announced the expansion of the current meal waivers that will allow us to offer meals at no cost to children under the ages of 18 until September 30th. Specifically, parents can continue to pick up meals for their children, which allows the district to continue to offer meals outside of regular breakfast and lunch hours and multiple meal pickups. These options are available until September 30th. However, Congress will conduct a hearing, and we have been asked to share testimony on behalf of our students regarding the impact these changes will have once the waivers are discontinued. We will be asking for the continuation of the waivers until the end of 2022 school year, and the opportunity to revisit the waivers if we continue to have children that remain on remote learning status. Our goal as in Food Nutrition Services is to continue to advocate for all of our students and their families and their health and access to meals. With that, I return it back to Ms. Megan Costello or Superintendent Caselli.
Great. I just want to thank the entire team for their work. As you can see, counselors, it's evident that this has been an all hands on deck from a stellar group of individuals who are committed to our children, their well-being, their health and safety, their nutrition, making sure they get to and from school safely. And I'm sure that President Tang will share with us what the teachers are doing as well academically. So with that, I'll turn it back over to you.
Thank you very much, Dr. Caselius, and thank you for that presentation. I'm wondering, just for the sake of time, we'll go to the next panel, starting with President Tang, so that we can get through that and colleagues can ask questions of both panels at the same time. President Tang, are you with us this afternoon?
Yep, I'm here.
Wonderful. Thanks for joining us. There you are.
Yes, thanks so much. And I just wanted to appreciate Madam Chair Anissa Sabi George and all the city councilors for having us here today. And also do want to recognize just how hard folks in central office and all of the partners, everyone from our custodial staff to our bus drivers, bus monitors, our cafeteria workers, etc. As you could see from those reports, it really has been an all hands on deck and a situation, and everyone's had to do their part. I think sometimes the general public doesn't realize just how much detailed planning and hours of work go into making a school day run smoothly. And that's from the minute a student goes to the bus stop to the minute they get to the school steps and back. And meanwhile, our educators have been trying to balance not just instruction and academics, but all the other needs of students, including their social emotional well-being and their physical health, and also running point on a lot of the different presentations that we just heard from. So as Mark Christine mentioned, on top of teaching are also the tech coordinators. A lot of them are also the PPE coordinators, the testing coordinators, all these additional roles on top of instruction and teaching. And so we have certainly, appreciated the opportunities where we've been able to partner and work together, and also do want to appreciate the city and the district and the superintendent for their leadership on vaccinations. We had reached out very early on and were concerned about the ability for educators and school staff to be vaccinated, and the efforts were proactive. And so when the availability was there and we were able to get the vaccines to our educators, there was a plan. And I really do want to commend and give credit where credit is due for those initiatives, and the partnerships with the community health centers and hospitals has been incredible too. Just a really fantastic outpouring of support to get everyone vaccinated as quickly as possible. So there are certainly a lot of successes and a lot of learnings. There also continue to be, of course, challenges, as this whole year has been a challenge as we continue to try to adjust and be flexible and adaptable. As the superintendent said, the knowledge of the virus has changed, the mandates have changed, the guidance has changed. And throughout this whole time, we've always been consistently committed to helping get our students back into schools as quickly as possible and as safely as possible. And that has continued to be our priority. Even with educators getting vaccinated, we worry about this possible in-school transmission because it does still happen, but with our families and students bringing it home to their families who may not be vaccinated. And the strict enforcement is recommended still by the CDC of all the mitigation protocols. And then I think the biggest challenges right now, I think, are that with the new mandate from the state, it has really upended, I think, the plans that the district has been meticulously putting together and planning for the hybrid rollout. And so a lot of the energy, time, staffing, supports, resources that we were already implementing and working with the district on to plan for the summer and also for the fall have been put on hold for a little bit so that we can actually scramble and figure out how to adjust to the new mandate over the next few weeks and successfully and safely implement the new mandate from DESE. And that doesn't address the many new protocols that need to be put in place in order to still have the, even with 3 feet, the adequate facility space, the ability to have places for meals, breakfast and lunch at 6 feet of social distancing. There's a lot of planning that still needs to happen. So from an educator perspective, it's been a really, really challenging year. Educators have gone above and beyond to help, with everything from the meal deliveries to the Chromebook deliveries to adapting instruction constantly. And that probably is one of the number one issues still right now, is that educators are having to teach simultaneously, both in person and virtually. And it's two very different types of teaching instructions and pedagogies. Teachers were getting pretty good at the virtual instruction, and of course we know how to teach in person, but to be able to do both at the same time continues to be a really big challenge. And so you'll see, the district is trying to offer, and we're trying to partner too, to provide more supports for how do you do simultaneous teaching well, and all of those PD spots have quickly filled up. And this will, I think, continue to be a challenge through this year. And we hope that with adequate time, resources, staffing, et cetera, that we will be able to improve that and have teachers who are teaching in person be able to focus on that, while those who are teaching virtually are able to focus on teaching virtually. So that continues to be a concern, and we do hope that the state hears the concerns of the district in terms of needing the time, resources, and adequate opportunities to ensure a smooth rollout of the next phase. And that we would hope that they would also provide some more guidance and support in being able to do that well. So I'll stop there, but that kind of summarizes what we're facing right now.
Thank you very much, President Ting. We were also joined, just for presentation, by Dana Griswold. Dana, you here with us?
Yes, hello.
Hi, how are you? Welcome. Want to give some brief remarks? Marta, you'll be after Dana.
Okay. My name is Dana Griswold. I'm a K0, K1 center-based teacher at the Blackstone Elementary. For those who are unfamiliar, center-based classrooms are substantially separate classrooms of special needs students. So all of my students are on individual education plans, and their ages 3 to 5. So not only do I teach K1 students, I'm the parent of a K1 student in BPS. My 5-year-old son, Zephyr, has been attending the East Boston EEC remotely since September. So I really understand the challenges that parents have been feeling with early childhood students attending remotely. It's tough, maybe not as tough as simultaneously teaching early childhood students in person and remotely, but still it's quite challenging. And to be honest, this year has been very challenging for the Blackstone. We have reopened in-person learning at the Blackstone 8 times since September. Twice for the high in-person priority students attending hybrid in October, again for them in 4 days a week in December. For additional high in-person priority students on February 1st, then twice each for our hybrid students in K0 through 3rd grade, and then 4th and 5th grades earlier this month. So you think with all of this reopening that we've done, we would be experts by now. But for those of you who are educators, you know that it takes 1 to 2 weeks to reteach classroom protocols and procedures to each group of students successfully in a normal school year. And because things keep changing, and in these times we have to learn about mask breaks and where you can go up the stairs and where you need to go down the stairs, every time we reopen, it feels like we're back at square one. So it's going to be quite a challenge as we open our doors to more students 5 days a week later this school year. And I felt very lucky to be at the Blackstone this year. Our schools is one of the safer buildings in Boston Public Schools. We have an HVAC system with a MERV 13 filter. We have air purifiers in our classrooms, and we have great support from our administration. And I know not all of my colleagues in BPS have been this lucky to have a building that's a safe. Even so, I've been very anxious about myself, my students, many of whom cannot wear masks because of their medical needs, and my colleagues like my paraprofessional who's in her 60s with diabetes, high blood pressure, and kidney issues, none of which qualified her for an early vaccine. And then in December, right after we returned back to in-person learning, I found out I was pregnant with my 3rd child. Knowing that COVID infection is more likely to be severe in pregnant patients and that we're more likely to end up on a ventilator, I can't describe the anxiety I felt despite continuing to show up for my students in person every day. And that intensified when I became a close contact within my classroom twice in the month of January. I managed to get through those instances without a positive test, and still there are no words to tell you how relieved I felt when I was able to get my vaccine earlier this month. And I have to thank both the BTU and BPS for working so hard to get educators vaccinated, especially by creating educator-specific clinics on weekends, because right now another problem we're facing is we don't have a lot of substitute teachers. And so for teachers to leave school and go get a vaccine at their doctor's office, it's really difficult. So I'm just very, very grateful for that. And I know from talking to my colleagues, both at my school and at other schools, we are just grateful and relieved that this can finally happen. I'm very willing and happy to answer any questions about my experience with my school and my students this year. And I know this year hasn't been perfect for any of us, but we're all trying to do what's best for the young people in this city that we love. And we're not all in the same boat, but we're definitely all in the same storm. So thank you for your time.
Thank you very much, Dana. Marta Bausimer, welcome.
Yes, hi, welcome. Thank you for having me. I'm a school nurse for Boston Public. I work at Boston Green Academy. We're a 6 through 12 in Brighton. I've been a nurse for over a decade here in the district, and I'm a parent of a recent graduate from my school, actually, a BPS grad. So similar to what was just said, being a parent while being an employee gives you a very unique perspective, I think, on the goings on, right? So today I want to make myself available to be able to answer any questions that anyone might have about just the work of the school nurse, especially during COVID. With the global health crisis, our job is more critical than it's ever been. I feel extremely valued in the community that I work in. I have a wonderful school with a great support team. And while I have the chance, I wanted to say that the pool testing is critical to coming back, and for parents to feel secure and safe that their child is going into a building where they're testing kids and testing students. And I love the staff testing that's been going on, by the way. But the student testing, we do have support. We have support through the DESE program for 6 weeks, but then that support ends. And I just want to put a plug in for a push to extend that, because the nurses who are doing this in their buildings are definitely going to need some more help with that. Health services has been tremendous in helping the nurses at every single turn with this pool testing stuff. But as a parent, I feel like it's really important. And as an employee that works in BPS, I feel like it's critical that we extend that that help and that support that can go into all the schools as we increase students coming in. There's a lot of needs. The nurse's office is busier than ever. It's always busy. It's busier than ever with COVID. So here to answer any questions. Thank you for having me.
Thank you very much, Marta, for joining us. And then Fabienne, do you have any remarks to give before we go to council questions?
Yes, thank you for having me, for the invitation. I am really glad to just be part of the conversation as a parent, and as well for SPEDPAC and a C-Plan member. I do have few questions, and I believe that some of the panelists already mentioned that. I am aware of, and also give some great feedback of all the work the administrations has been doing on behalf of the students and the parents. But the question is this all the services are being equitable of being in the hardcore of the community that's being more affected? So of that being said, it's like, we want the students to go back to school, definitely. But in the next couple of weeks, as the teacher mentioned, trying to reteach the kids and trying to just be able to bring them to the classroom, how's that going to be able to just, by the time to teach them? They lost a lot. How are we going to be able to just make sure that the kids are graduating, that they do have the services, the support that they need, so they can be able to go to the next one? Not all the students are going to be able to get probably the services or accept to go to the summer classes, but I know that they are doing everything that they can. And on the vaccination, we know that, we can do better of trying to get all the teachers to and administrations to get the vaccine, but I haven't heard much about the transportation of the drivers. Are they getting to be on the forefront as well too? Do they have the time frame to be able to just help them to get to those areas? We know that, the hotspots, the internet is still an issue. So we having where, going back in the buildings, are they going to be able to just support those kids to make sure that they'll be able to just get the internet? It's working on that. A lot of students, middle school and high school, they're scared to go back to school. if they do go back, if the parents said, okay, they have to go back, what is the support they're going to be able to get them to be able to just get that social emotional support, that not being in that fear. We know that, in the classroom, where students used to be 24 kids in the classroom or 22 kids, we have to be 3 feet apart. Do we have the space? And my last day, what I'll be questioning to put it there is all the HVAC and all the service that they've been putting in the building or the work, is it the school that has to be able to change all the filters and to make sure that that's continuance on the air qualification, or is it going to be the district to support that? And how is it going to be able to just to affect them? Because we want to make sure that we're safe, not just today and, all the time. And I'm hoping that the district and as well the school principals and everybody just put some kind of data and some protocol if we have to close or ever we have to be in some sort of disaster again. We have a plan. We have some kind of a book to say, okay, how did we do that? It's not, we're not reinventing the tools again to make sure that we're not going backward, we're going forward. And I wish that, they could say, let's bring this together so we can be able to get ready for September in the summer. But I'm afraid to say, okay, you know what, while this is going, we have new string that's coming up. Are we planning to just down the line to just close again in mid-April, May? How does that look like? So those are the things that I just want to bring in. I'm very grateful to see, the work is moving forward, like we're trying to work as a team, but also the fear is really, is extreme because not everyone's prepared or feel comfortable and prepared to think that BPS is ready to just open up. And, asking for the waiver to go end of April, is it justified to say, okay, we can still go to school and be ready for the next 2 months for schools, or just waiting until the summer to just so we have a better plan in September? Thank you, Council, for inviting me and for being here.
Thank you, Fabian. Thank you very much. And thank you to everyone who presented today. I will ask my colleagues to keep their questions to 5 minutes. I'll start one for myself. I have a couple of quick questions just to start us off before I go to colleagues. But Superintendent, with the waiver that was requested of DESE, what is the plan if there's a denial of that waiver? Or are we expecting approval of that waiver for an April 26th start? What are the major pinch points that are delaying any earlier start, maybe in accordance with that April 5th mandate by DESE? And then is there an opportunity to send some of our younger children to school or let them have the option to be in school full-time earlier?
Well, thank you, Madam Chair, for those questions. So we filed the waiver this past Monday, and we have been working closely with DESE, have had multiple meetings with them about our waiver. So they're aware of all of the pieces. So we have this submitted. I think they just need a day or two to continue their review of that. So we anticipate acceptance. If for some reason we don't get that, I think what will happen is the commissioner then will ask us to just provide further information. And then we should be able to get the waiver. I mean, I think he's already approved 26 or almost 30 other districts for that same time frame. And a district as large as Boston. We just want to make sure that we are taking into account the health and safety of our students and of our teachers and educators, school leaders, our entire community, and doing it in a way where we can operationally do the kinds of additional mitigation efforts that we need to do. As you know, the CDC gave us a new, but guidance that showed you go from 6 to 3 feet. All the stickers in our schools right now are 6 feet. So, there's just some additional operational things that we need to do to comply with the new guidance and to move furniture around and to be ready for our students. And in terms of coming back early, we just really believe that as an equity measure, we wanted to bring everybody back at the same time because there are some schools that have HVAC systems, like we heard from Ms. Griswold, and other schools that don't. And so just didn't feel fair to have some of our schools that have better facilities to be able to start before some of our students who didn't have them. That's one of the things. And then we have other schools where they, you know, have 95% of their families saying they want to come back to 5 days. And we've got to be able to go in there and move furniture and store it. That's going to mean new ways to monitor and tag that furniture so that they can make sure they get it back before teachers want to give it up. So we're doing a bunch of that work. And so I think 58, I just got a text. It's 58 districts have been approved for that same date, not just 26. So.
Thank you very much, Dr. Castellius. I think with the younger students that are already in school, I wish there was an opportunity because, you know, we've talked through the course of these hearings how important the babies are, and you know, the desire to really have them in school or the opportunity to be in school at a higher frequency. The sooner we could do that, the better, for sure. But at this point, I would like to move to colleagues. Councillor Bach.
Thanks so much, Councillor Sabi George. And yeah, just thank you so much to the district for all of that information and all the work that lies behind that information, and to the BTU and the teachers we heard from and all the stakeholders. I just want to echo that it's been a really hard year and there's been so much work. I have a couple of quick questions. One is just, I wondered if you could speak, Superintendent, to the sort of mixed messages I've heard about, you know, parents being able to keep their child remote, but then if they go in person, how absences are going to get credited. There's just been a lot of that conversation coming our way as counselors, and I think it would be helpful to have that addressed directly.
Yeah, it was frustrating to see the guidance from DESE that talked about attendance originally. Chief of Staff Mary Dillman and some others from my team, and I'm sure that the commissioner heard from other folks as well. I know that President Tang also mentioned this to him, that they had basically said that hybrid learning no longer exists after April 4th, which then meant there are only two ways to mark students for their attendance, which is in person or 5 days of attendance. Even though our guidance right now says that there's you know, we had to adjust our guidance to be able to mark kids in person, remote, present, and remote, like online present. So we have those two options for teachers now. So it didn't make a lot of sense to us as educators that we would shift this on families and parents. So we pushed back on that. We do think the commissioner might be considering that and issuing some new guidance in the next week or so. So, you know, I think that that's an important adjustment I'm hoping he'll make. So that if parents are signed up for 5 days and, you know, they have something they're quarantining or they have something else going on, or that they can access remotely. I mean, we are entering a whole new era with our students being one-to-one, and parents have had this flexibility now for the entire year to be online, and they've learned a lot. Families and parents have learned a lot about communicating with their teachers, and the importance and value it is to have a strong relationship with your child's teacher. That, I think, is going to be a positive learning going into the new year, and individualizing and personalizing instruction to students by using software or using technology or using paraprofessionals differently. And the way we instruct students doesn't necessarily have to be bound to bricks and mortar.
Yeah, no, and I think also just that, I mean, the last thing we want would be a parent who, you know, wants to send their kids back, but knows there's a day a week where the way their pandemic schedule is set up and all, they need to be home, and then feels like, oh, I can't go part way because of this. Yeah, I think it's just, maximizing the flexibility for our families. I've heard from lots of families who want to be back five days a week, and who are now the kids are back 2 days a week, and they're experiencing it as a minor tragedy each week that they don't get to continue on. But I just think we should be trying to support everybody's needs in this moment. Could the transportation folks speak a little bit more? I think both at our transportation hearing and today, there was a reference to new DESE guidance that affected our buses, but I don't think I've actually heard exactly what it is that has updated or changed that we need to implement on the bus side.
Thanks, Counselor. I can answer that question. So the new DESE guidance that was that DESE gave a few weeks ago is that on buses for elementary school students, DESE have lifted its previous guidance of one per student per bench, right? So when thinking about returning kids to schools and rerouting buses, et cetera, with the additional students coming on board, by lifting the guidance, that means that the transportation, there are more seats on buses that would be able to accommodate students, because during the pandemic, we did have to cut down the number of students that are routed on our buses, and our capacity was cut down to 35% capacity.
Got it. So it's actually something that, you know, if we feel like we can implement it safely with, you know, all of our stakeholders, it would actually give us more flexibility on the.
Yeah.
Got
yes,
it.
We are working in collaboration with all of our stakeholders on this.
Great. Awesome. That's fantastic. I was going to ask just a quick question about food services. I guess to me, it's felt like throughout the pandemic, one of the things we've seen is that, like, in many ways, we've uncovered food need that we already had, and our emergency systems have helped serve it better. And I know you mentioned, you know, support for waiver extensions. I just wonder if the system could, if the food services folks could speak to, like, in terms of learning and opportunities after this, what we think we might be able to do with this BPS food architecture that's been built to support keeping, like, all of our kids fed going into the future, or kind of how you're thinking about that piece.
That's time, Counselor Bach. So Laura, if we could just be quick with our response. Thank you.
Sure, of course. I think if anything with this pandemic, it's definitely opened up our creative juices of how we want to be able to provide access to meals for children. What we have learned is that there's different ways of how different children are eating, how they, and just the limitations that they have to be able to get meals. So I think for us, when we're able to share our testimony to Congress about how, when they're thinking through the Child Reauthorization Act of this year, that we're certainly going to be bringing those points back of how we can continue some of these processes, maybe even the continuation of these waivers outside of the pandemic, so that it doesn't limit us for very specific rules and regulations to provide meals to kids.
Thank you very much. Thank you,
Madam Chair.
Counselor Campbell.
Thank you, Counselor Sabi George, and thank you to all the panelists for your hard work and for being here. I care deeply about just the reports around learning loss that all of our students, of course, are experiencing, but it's also being, of course, sort of exacerbated for students who have special needs, of course, who are on IEPs, English language learners, the mental health challenges, not just for our students, of course, for our educators and staff members as well. I know there'll be a separate hearing, Counselor Sabi George, on this particular hearing order. So looking forward to that, because I do think it connects to the reopening conversation around which assessment tools are we going to use to measure where our students are, how are we going to use the summer to make up for the academic loss, for some of the mental health challenges for our educators and students, and what does the summer look like in terms of planning for the fall, and given space for our educators and teachers and others to plan in partnership with families for the fall. So looking forward to that hearing, but did want to lift it up because it connects very much to reopening. I'm going to be as quick as I can because frankly, we're an hour and a half in and I feel really bad that we haven't gotten to any of the families who are sort of in the standby room, and obviously are busy as well. So one I will say is, for the families that we were not able to reach in the survey, how are we reaching those families who did not participate? The second is, I know Counselor Sabi George asked a question on timeline, but what is the timeline or the date to where we will be presenting an option to our families to return to in-person instruction? And what does the fall look like? Because in addition to families we're hearing from in my office around the desire to, of course, return safely and to protect everyone in that process, there's also concern based on some emails of various things from the district that the fall next year is going to be hybrid, major concerns about that. And parents are like, absolutely not. So just what is the timeline currently? What is it for the fall? And then lastly, infrastructure. I really appreciated Dana, lifting up, I don't know where you are on my Zoom, on the, the infrastructure. Some schools have great buildings, Blackstone, my former school, but then I have the Greenwood School, which is in desperate need for a temporary location right now. And I know Superintendent and your team are looking into this immediately, but there are other buildings. So how are we helping those schools that don't have the infrastructure and safe infrastructure right now find safe temporary space? We haven't done that for every school. What is the strategy? Well, of course, we have the larger conversation on Build BPS.
Sorry, I was on mute. So the timeline for in-person, I just want to be really clear with the public, is we are planning full in-person this summer and full in-person this fall. So pending any other type of surge or variant or anything like that, we believe that we have enough vaccines and the science is there and to suggest that we will be able to open fully this fall. So that's what we're right now planning for. As for the family survey, we are continuing to reach out. It's open until the end of the month on March 29th. So parents can still go in there and change their preference if they'd like to. We'll honor all preferences till then and get their first choice. And then after that, we'll continue to work with school leaders and their teachers to make sure that they have the preference that they've desired. So if a student is defaulted to in person, for instance, and they're not showing up, but they're showing up remotely, then we will make that change. So also in terms of infrastructure and the larger question around Build PPS, as you know, as you heard from Ms. Griswold, we have opened all of these times and reopened and closed and reopened, which has been all consuming. So we've been taking a lot of time to engage with our community around that. And we just haven't had an opportunity to get back to the capital plan, which is a big piece of the work that we need to do. Obviously, the pandemic has shown an incredible light on the fact that our buildings are old and lots of work needs to still be done. So I appreciate you bringing that up. Hopefully over the next couple of months, we'll restart that work with the community. Obviously, the Quincy School project is going forward. The Carter School project has been in design and moving forward. The Boston Arts Academy put their last beam in. So that project is going on. And then we have our renovation project over at the McCormick School that we will be doing some design work with the new team once that's merged there as well. So those are the major projects that are currently in play, but there's also clean water, clean bathrooms, and other upgrades that we're making to windows and to roofs as we go through the summer.
Major issue. Okay, I heard
Councilor Campbell. Sorry.
Hi, Jessica.
Hi. I'm not sure if the question was only directed to the superintendent, but I did think that there were a few important also additional just perspectives to share. So we invited on our panel a nurse, a teacher, and a parent, because we also do obviously care very deeply about the voices of parents. And some of the questions that we've gotten from our parents actually have been around the lack of hybrid as an option at all. And so in the survey, DESE only allowed for either 5 days in person or remote. And as Councilor Bach mentioned, there was a lot of questions about, well, what if there's a day that I can't send my student in, I don't have childcare or no one to pick them up from school, what do I do then? And if they're remote, does that count as an absence? And originally DESE has said that you have to follow the protocols with absences. And if you have a certain number of absences, then that triggers other measures, right? And so a lot of parents did not feel comfortable picking one or the other and actually preferred hybrid for a number of different reasons. And I think another important perspective we heard too is that even the families who may have wanted to send their students in person, because of the shortening of the distancing from 6 feet to 3 feet, had a lot of health and safety concerns about whether or not that was indeed safe, because a lot of the studies are actually based on not urban schools with facilities like we have, but very different facilities. And the third concern we also heard was also about the fact that they don't have before and after school programs. And a lot of families really depend on this before or after school programs to be able to send their children to school because they may not have the morning or afternoon ability to pick up or drop off their students, or if they take the bus, that there's no one at home. So those are also, I think, considerations that impact the parent choices. But I do think that the surveys are a little misleading because they didn't get to choose, hybrid. They could only pick one or the other with very limited information of what that'll actually look like.
Thank you, Councilor Campbell. Next, we have Councilor Mejia. I also want to note we were also joined by Councilor Flynn, and Councilor Flaherty has also joined us. Councilor Mejia?
Yeah, thank you. I'm sure you got that timer on me, right? Councilor Asabi George, keep me in line. So I'm just curious, and I'm really grateful for the panelists that are here. I'm sad that I'm hoping that we can get to the parents and the folks who are in the waiting room to be heard. I think those voices are really important. So I don't want to occupy too much space here. I'm curious if you, my daughter got an email, Superintendent, in regards to allowing for the pool to get tested, and we could opt in or out of it. She chose, she didn't want to be tested on a regular basis and like whatever. Trying to give my daughter some autonomy in that process, but I'm just curious about what challenges, if the nurses can just talk to me a little bit about, because I did have some concerns about what that would look like and what the process would be and what the communication would be with families. And so we opted not to to participate. But my question is in regards to the nurses, if you could just, from the nurses' perspective, you could talk to me a little bit about some of the challenges around the pool testing situation.
Yeah, I can jump in. And Jenny, I know you're still on here too. You can jump in too. So some of the challenges, and I really appreciate your question. I think that is a great question. I think there's a lot of stuff that goes into pool testing. I don't consider myself an expert by any means, but I've definitely looked into it a lot as a parent and as a nurse that works in the schools. Pool testing is absolutely something that takes a lot of planning. I have read up on it, at least from the CDC, takes like, a couple of months to plan. The superintendent and her team had put together to have pool testing in the schools. Health Services has taken on a great deal of it to take some of the burden off. I think if you're a school nurse and you're doing it in your school, you're working really hard. So something's got to give when you're taking on something that's so big. And as more students come into the buildings, it'll become even, I think maybe it'll take over a lot, So I think nurses need help. If nurses need help, then they got to be able to find it. So I think finding some support for that would be huge. And then the other thing I was thinking about was, if there was a way to extend the support that we're getting, right? So that 6 weeks, that DESE program, I think that's really everything. I think you can't stop it at 6 weeks and then increase the number of students in the buildings. Mm-hmm. We need to have that in place, I think, to make it work really well, not because nobody can do it or can't do it, or it's really just about making it the best program that we can, right? Because I feel like I'm a parent and I'm basing a lot of my kids to go back knowing that maybe they don't want to test, right? My kid don't want to test, but I know the other people in there are testing a lot. So that makes me feel better. That's right. So I think it's really big. And I think it's a big thing to talk about. And I think the nurses have just done a tremendous job. And not just because I'm one of them. I mean, really, it's a big undertaking. We have this health services team that I think they just filled in every single little corner or crack that they probably could have to try to help us with it. But, I really think that it should be reevaluated as more kids are coming into the buildings so that we can make it the best program that we possibly can. So I hope that's helpful.
Very much so. Thank you. And I'm curious, Superintendent, my daughter started hybrid last week. And I also got the survey, and I would have to say that I didn't get the option to do hybrid. It was just like, it's something like all or nothing, right? And so I just think that the option of hybrid for some families may be worth reconsidering in terms of adding that to the survey. I just think options are great.
Counselor, I just want to make sure you know that was not allowable.
Oh, okay, all right.
Because there are only two options that the state's allowing.
Got it.
And they
Okay.
asked us to survey on those two.
Okay, got it. So then I'm curious, what is the district doing to address the challenges of simultaneous learning? I know that my daughter, in her class, there were only 7 students in her class. How are you guys grappling with the simultaneous learning? I know that it's hard to, even as a parent doing the remote learning and trying to remote work and then also help support my daughter. I'm just curious, like, how's the district dealing with the challenges of remote learning? I mean, with simultaneous learning.
Yeah, so I acknowledge the difficulty some of our teachers are having with the simultaneous teaching. And, this is something that President Tang and I realized right away from the original MOU. And so we worked together at the end of September of last year to have principals work with their teachers on creative scheduling and staffing within their schools to be able to have one teacher working in person and another teacher who was teaching the remote students. In some cases, that's working out. Where you have single strand schools, it's much more challenging and difficult to have those creative schedules, meaning you just have one grade level taught by one teacher. And so that makes it more challenging. But we also are providing professional development. We've done a lot of professional development. Teachers are teaching each other and sharing their best practices from classrooms and school to school. The regions are coming together with their regional superintendents and sharing those best practices across schools as well.
Thank you for that. I always just, every time when I'm in one of these hearings with Councilor Sabi George, I always get traumatized about, like, I'm going to get pulled out. So do I have any more time? Because I do have a few more questions, but I want to be respectful of your process.
Yep, the timer has gone off. If you want to have one brief question additional, that would be fine. Everyone else took a little extra.
Yeah, no, thank you for that. Are we going to do a second round, Councilor Sabi George? Okay, so I just want to ask Dana to kind of follow up a little bit about to that question in terms of the simultaneous teaching, Dana, and you're a mom and you're a teacher, so you got this from all different perspectives. But I'm just curious, can you just share with us what you think could potentially help? And then I'm going to have some questions for the parents in my next round.
I think the superintendent is absolutely right that creative scheduling has been a huge part of helping teachers be able to manage the workload that we have when we're doing simultaneous remote and in person. In the fall, I was doing both. And then through a creative scheduling plan with a co-teacher next door, we now split our students so that one of us is doing the remote teaching 2 days a week and the other is doing the remote teaching the other 3 days a week. We're both in school full time, but that way we can share our paraprofessionals. And so the students always have a teacher and then 2 other staff, while the students at home are still getting a quality experience without the teacher having to do both things at the same time, which takes it's a completely different teaching style to teach kids remotely and then it is in person. And that way our attention isn't split between kids, especially having special needs pre-K students. They can't use a Chromebook at the same time. They'd need an adult for each child. And we have 6 in our school and then 4 at home. So, it's just impossible to have somebody with each student. So I would think that the creative scheduling plans, and I've advocated to everybody that I know, teachers who can join with another teacher or find a way that they can split the teaching load, because it's very hard to do both at the same time.
Yeah. Thank you, Councilor Sabi George, for giving me an extra little time. And Fabian, I'll ask you a question in my next go round.
Thank you, Councilor Mejia. Councilor Flaherty.
Can you hear me, Madam Chair?
Yes, we can. Welcome.
Very good. Thank you. Thank you for the courtesy. Obviously, thank you for hosting and chairing this timely hearing, given the most recent announcement. I guess a couple questions I have of the superintendent. I know that she indicated that some of the parents didn't respond to the survey. So I guess I'd like to know, what are we doing with respect to outreach to those kids? And then to the president, President Tang, for the president of the union, I was curious to see how many of our teachers and school administrators have been vaccinated to date.
Yep. So we said we had about 80% of our staff vaccinated from a self-survey where they told us. Am I on? Okay, I'm on. Yep. You can hear me, right?
We can hear you, yes.
Yes, I can.
Okay. So that was in my opening comments. And then your next question about follow up on those students who did not respond. So that's going to be a multi-tiered response for our families. So it's open until the end of the month, 3/29. So we really hope that we get it back. We have about 70% of our families have returned it. So that's a good response rate right now. And then we'll turn back to our school leaders and ask them to connect with teachers and see who hasn't turned it in, and then try to get them to turn it in through their regular communications and check-ins that they're having with families. We may also do a central office push if it continues, if we're not able to get in touch with families, and use our attendance officers. That's what we've done in the past.
Hi, Counselor Flynn. The superintendent answered the question for me, I think.
Oh,
But
I'm sorry.
no, I think that's fine. I mean, correct me if I'm wrong, but our universe is around 10,000 school staff. Our BTU educators around 7,500, and based on the vaccinations, both at the BPS site and through the partnerships with BPHC and the local community health centers, BMC, so many great partners. I do think it's about 6,500. So we've been very aggressive about getting the information out with all the clinics and everything, and every week send out the latest clinics information. And as Megan Costello shared, they've been great also about setting up a phone line too, because you can't always pick up the phone as a teacher when they call back to try to make the appointment. And so all of those efforts, I think, have been really successful in helping our educators and school staff to get appointments.
Very good. It's Council Flaherty, Madam President.
Sorry.
No worries. It's obviously, it's hard to overstate how challenging this year has been to our families, students in particular, and the entire school community, our teachers and all the professionals that do great work in our schools. I know that there are some families whose preference remains remote learning and or hybrid, but there's also many families, many of whom call my office, who prefer in-person learning environment, obviously, and having that done safely. I can't emphasize enough that obviously recognizing our achievement gap, our opportunity gap, our wealth gap, and the fact that we're in a global economy, and the fact that parochial schools and private schools and schools in sort of surrounding suburban communities are sort of back in action. I can't emphasize enough that we need to get back to school. Teaching and learning has to get underway as quickly and as safely as possible. I'll continue to be a partner any way I can in that effort. And I don't think we've discussed it at this hearing, but if there's any thought been given to summer sessions and catch-up sessions and things like that, that I think would be important. Our students have missed a significant amount of learning, and they're competing. They're competing with kids in parochial and private schools. They're competing with kids in other cities and towns. And you think about, all the CEOs that companies that are here now, and CEOs that are moving their companies here because of the brain power, because of the workforce. We want to make sure that our kids that live in the neighborhoods of Boston, are going to be able to compete for those jobs. And I'm not just talking about loading rooms and mail rooms and being able to participate in the trades and to construct the building. I'm talking about the corner offices, the CEOs, the COOs, the CFOs, those positions. And that really depends on the work that we're doing now. If we want our students to be able to compete in the future for those jobs, to help again close that opportunity and that wealth gap, it all starts in the classroom. So as soon as we can get back to the classroom safely, I urge and implore everyone to do that and work together to make that happen, because other jurisdictions are doing it, and even schools in Boston are doing it. Again, I know that they're situated a little bit differently, and they may be teaching students that don't have as many of the needs that we as a city and our students have, but we need to continue to work together, collaborate to make that happen yesterday. So thank you, Superintendent. Thank you, Madam President. Thanks to the superintendent's team, and thank you, Madam Chair, for hosting the hearing and letting me ask my questions and opine a little bit on the need to get back into the classroom. Thank you.
And apologies, Councilor Flaherty, and hear you loud and clear, and know that we have been working very closely and as collaboratively as possible on the summer learning, for example. Early in January, I'd already discussed with the superintendent putting together an advisory group so that we could make sure that we're hitting the ground running this summer and fall. I do think it's respectfully a little unfair to compare the district, which has over 50,000 students and 125 buildings, to Catholic and parochial schools and private schools that are dealing with a very different population. And also, we'd love to have some of their facilities and some of their class sizes too. And I think that actually has been one of the biggest challenges. Our class sizes are upwards of 31, 28, 25, depending on the kind of classroom. And our facilities do limit even 3 feet of social distancing, which continues to be a challenge. So I just wanted to say that we all have a shared interest in bringing back all of our students in person as quickly and safely as possible, for sure.
Sure, and through the chair, I understand, Madam President, obviously that our system, BPS, is significantly different and has many more challenges than any other district. My point in that is that those students are going right by our students. Those students are in school, and there's teaching and learning going on, and those are kids that are going to be able to sort of compete, whether it's SATs, et cetera. So 100%, I agree with you. The challenges that we face as a school district, the sheer number of students, and collectively all the issues that we're dealing with as a school system, 100% fully understand that. And I raise it just for the simple reason is that there is teaching and learning going on in certain schools, just not ours. And that pains me because I know the great work that is going on in our Boston Public Schools, and I know the work that our teachers do. And obviously I know the students and the families want their children back to school. So I get all of that. I just don't want folks going by our students. That's all. And that includes suburban districts that are completely different than the Boston Public Schools, but they're going right by us. And I just want I want us to catch up.
Thank you. And understood, but we have virtual learning happening, and there is teaching and learning happening in the virtual settings as well. And I invite you to visit some of those classrooms where teachers are doing incredible things, both virtually and hybrid. But thank you, I understand.
Thank you, Councilor Flaherty and President Tang for that. I'd like to do just a brief round of follow-ups with colleagues, quick follow-up questions that sort of remain from some of the questions my colleagues asked. Superintendent, I know 70% or so of families responded to the survey. Can you tell me, just remind me, you said it quickly in your remarks earlier, what the response has been so far with how many want in person versus remote? I know that we're maybe saying that the survey was flawed, but what were those response? What was that response? Oh, unmute yourself, please.
I'm going to have Mary Dillman, if she's on. She probably has the data pulled up right in front of her, and I don't want to misspeak. If she could pull that up.
Sure. While Ms. Dillman is doing that, I am curious with Dell regarding bus transportation. DESI currently has 35% capacity, as noted. Do we think that will shift on April 5th to increase capacity? And if so, to what? And then what is our usual capacity to begin with on our school buses?
Thank you, Councillor. So our department is working in collaboration with our senior leadership team and also BPHC to safely look at the best ways and to safely adopt some of the DESI guidelines. Our bus capacity was cut to 35%, one student per bus. One student per.
Do we expect or anticipate that capacity to increase on April 5th if DESI is requiring schools to be fully in the ability to be fully in session on April 5th?
Yes, some of those, we're going to have to adopt some of the new DESI guidelines surrounding capacity, and we're working with some of our our union partners and other teams on the best and safest way to do so.
And what's our current capacity on bus utilization?
On our big buses, we can transport about 55 students on our big buses.
What's our general capacity though around assignment to those buses? My
On,
understanding is we're generally only at 50% capacity anyway on a normal, like sort of regular school year.
yep, so that's a good question. So I don't know the exact number off the top of my head, but and I can get those numbers to you.
Perfect.
But one of the things that I always share with folks is that we usually run out of time, right? We quickly run out of time before we run out of space on buses.
Right.
So how students are allocated throughout the city plays a big role in the number of students. So we have some of our buses that are at capacity, or sometimes folks see a big bus like transporting one student. It's all about how it's routed, where students are distributed across the city, and programs that they're attending.
Perfect. Thank you. And then my last question is,
Can I answer? Counselor, do you want me to answer the question? Because
then Mary, give it to you. Yes, please.
I went to the dashboard, so I have that. So we have about 18,147 who did not want to change from hybrid to in-person. So there's no change. They're staying right like they are. We had 4,389 went from remote to in-person. So that's 4,389 went from remote to in-person. We had 3,368 that went from hybrid to remote. And then those that are in remote and just stayed remote are 12,280.
Great.
We had 80% that approximately not changing their learning model, and a 74% response rate.
Great. Thank you for that. I appreciate that. And I will check out the dashboard. I should have done that first.
That's okay.
And then with the new 3-foot requirements, how many classrooms, do we know how many classrooms may still remain offline to respond to or to meet the requirements on spacing and still be in person?
We do know that, but I don't have that technical information right in front of me, but I will get it to you.
Great. Thank you. Appreciate that. And I do want to get to my colleagues again. And Councilor Campbell, we'll try to keep it under the 5-minute mark this time around. Councilor Campbell, you're next. We'll skip Councilor Campbell. Councilor Braden, welcome back.
Oh, I never went away.
Oh, I'm sorry. I missed you in the last round. I was sure to be careful to see you.
Yeah, the question I had was really, thank you. I'm really impressed with the incredible depth of information and data that we have, and for everyone's incredible work. I don't think we can really comprehend how much detail and how much planning and goes into this orchestration of all this coordinating of all these pieces. The one question I had was really with regard to summer school plans, anticipating that we will be in a better position now than we are even now. I was wondering if it's too early to talk about what your summer school plans are.
Yeah, so thank you for that question. We have a pretty robust summer program planned for about 27,000 students. We anticipate anywhere from 8,000 to 10,000 students that will take enrichment opportunities with our Boston After School and Beyond partners, as this is affectionately called the 5th quarter. And so it's a great program with over 200 partners within Boston Public Schools that partner with Boston After School and Beyond. Then we have a number of schools who will be offering their own summer school, almost like an extended year, where they have relationships with teachers already who know them and love them and know exactly where they're at and what they need to make up in terms of their learning loss, where they can give them that extra boost. Then we have some other academies and work. Of course, we'll do some work with our exam school initiative, getting this new cohort of students prepared. We will have jobs programs that we'll do with the city and with BPS and with our Learn and Earn program for jobs for our high school students. So lots of opportunities this summer to play, to learn, and to reconnect as a community.
Sounds wonderful. I'm very cognizant of the fact that we may have parents waiting to speak, Madam Chair, so I will waive the rest of my time. Thank you.
You're welcome. Thank you, Councilor Braden. I'm sorry that I missed you in the first round. I was careful to look for everyone, and then I missed Councilor Bach in this round as well. Councilor Bach?
Thanks so much, Madam Chair.
just a couple more quick questions for the superintendent and her team. I was encouraged to hear about our capacity sort of going to double on the tech side. But obviously the more students we have back in person while we're still doing synchronous learning, the more we're going to test that capacity. So does the district sort of feel like we're now at where we need to be with all of our buildings? Or is that going to be a big piece of the work in terms of running up to April 26th?
We'll continue to work on our tech work for sure. I know that Mr. Racine is here and can answer some of the particulars, but I know you all are waiting for your families. We do see that we are going to have to adjust some of the Zoom connections that we have because it takes so much broadband. And if you do have an entire class on Zoom and at Zoom at home, that's a heavy load. So on our systems. And so he's been working with Zoom. He's been working with our infrastructure at BPS in order to continue to remedy those bandwidth problems. I don't know if you want to add anything to that, Mark.
Sure. We've been watching very carefully, not just our bandwidth, but the instructional decisions and model that our teachers are making and our schools are making. The main difference for us is the difference between a teacher being on Zoom while the students are in the classroom versus everybody being on Zoom at the same time, which is why over the last few weeks, as we saw more and more folks come in and more students actually being on the Zoom at the same time as their teachers, we made some quick pivots to adjust our bandwidth. Right now, we are capable of handling full in-person returning, but we also expect when we do pivot to full in-person, that we're actually going to see less students on Zoom because more of the students will be in the class. So we're actually looking at April 26th as being a little bit of a decrease from our current bandwidth utilization.
Got it. And then for the superintendent and her team, are we expecting to also be asking for waivers in terms of the later middle school and high school start times? Or is the idea that we're asking for a waiver for this first thing to get us past school vacation and kind of rev up, but then we'll be on DESI's plan for middle school and high school?
Well, as you know, Counselor, we were already on a phase-in plan to return all of our students by the end of March, including our high school students. And so, to give a school district, 1 month notice to say you are going to have to completely shift your plans and do these new plans was quite a shock for all of us. And so we're rallying to open up 5 days a week and look forward to getting that waiver. He has not provided any guidance yet on middle and high school just yet. So we're waiting on that, but we are opening K-8. Hopefully if it gets approved on April 26th, we're already open by the end of this month for everybody 2 days a week, those that want. And any of our students who are high in-person priority can come 4 days a week as well.
Great. Yeah, no, definitely agree that it's a lot of logistics to keep having to do over and over. And the same with the transportation front. I hope for Dell just that I know that we are running slightly, but not much under budget on the BPS transportation side for this year. And I hope that adjusting to the DESI guidance in a way that's safe will enable us not to run over that budget as we bring more folks back. So just wanted to flag that on the budget side. But thank you, Madam Chair. I'm sure that's my time.
Thank you, Councillor Bach. Just under time. I appreciate that. Councillor Mejia.
Thank you. So I'm curious in terms of when we talk about exposure, I'm curious what that looks like. So let's just say, for instance, there's been an exposure in the classroom. Are all students, will our children have to be sent home to quarantine for a few days? Like, can you kind of walk me through what an exposure would look like? And how will the district respond to it?
Sure, I can, thank you for your question, Counselor. I can answer that. So when there is a confirmed positive case, whether it's a student or a staff, health services will start the work immediately once they find out of the positive result. And so what happens is there's a whole follow-up on close contacts. So first we have to find out who the positive individual is. Close contacts, anyone who was within 6 feet for 15 minutes or more within a 24-hour period. all of that is identified, and then we contact BPHC along with BPHC's recommendations on who is actually deemed a close contact. Then we get back to the schools and communicate that information. So anytime there's a possible exposure, so either if you're a close contact or if you're actually a positive, if you've been identified as positive on the COVID test. So that's our normal processes of contact tracing. So also facilities and cleaning takes place after that has been identified as well.
So I guess what I'm trying to get at is just kind of like walk me through, and I only have 5 minutes, which hopefully we'll go through another third round because I do have some follow-ups and I want to be mindful of my time. Is that, will the students be asked to quarantine at home? Like, what? That's what I'm trying to get at. Like, are kids being sent home for a few days until we work this out? And then I'm just trying to think of the process and how that will be disruptive to their learning. Like, kind of just help me understand that. And then I do have one more question that I want to get in, if possible.
Right. So if a student is positive, then yes, right.
But I'm talking about the entire classroom.
No, not the entire classroom. Only if you're deemed a close contact.
But if I'm in the classroom and there's 7 or 8 kids in the classroom
No. So you may be in the classroom, but because we're masking, because we have 6 feet distancing, you're not necessarily deemed a close contact.
Okay, got it. Okay.
When you are identified as a close contact through BPHC, you're not going to be told to go home and quarantine.
Okay. Well, see, I think that is a little bit scary for some families. The just kind of,
yeah,
because young people keeping their masks on and all that sort of stuff is a little bit challenging. But I'm curious about what in regards to the waiver. Is it honored that does it mean that the school will go for 2 weeks more, or will it close at the same time on June the 18th? So like by extending it, are we looking now at a later end date, or are we still going to be ending on June the 18th?
We'd still end on our calendar date that we have as our end date.
Okay. And then many parents would love to attend and participate in some of these meetings, that. And I'm just curious if there's any way that we can make them a little bit later so that parents can have an opportunity to provide input.
We will continue to have our meetings throughout, on evenings and weekends to make it more available. We've really been working on our engagement plan to make sure we include more families.
This is the bonus one, because there's been so much learning loss. I'm just curious, especially for those who are chronically absent already, who already were struggling. I'm curious, what is the plan to close that learning gap? My daughter got invited. It was under the accelerated program, and I thought that it was like, wow, my daughter's accelerated. But I quickly realized that my daughter was behind, but they were calling it an accelerator. So there's just some communication there that we need to work on in terms of just kind of that rollout. But I'm just curious, what else are we doing to support the learning loss?
Well, teachers have been working all year with students, and I want to thank our teachers for really working with families to make sure that they've been providing supplemental support where children have maybe fallen behind. So that's part of it, is to try to keep up. I know our head of schools have been working with students, giving some flexibility in their grading, allowing them to have an incomplete if the term ended, and then working with them after school and with tutors and mentoring to be able to get them the additional help that they need to finish and earn a grade, so that we can ensure that they get their grades that they need to be able to graduate and their credits, which is one thing I forgot. There'll be credit recovery as well this summer for our high school students. And then we have, of course, summer school. We will have acceleration programs there. We'll have our ESY, which is our extended years summer learning for our students with disabilities, and compensatory services for them as well being provided. All of those meetings are happening with families currently. And then, the commissioner today was saying he may offer some additional funding for acceleration academies. Those are just extra boosts for students to get ready to go back into the academic school year 1 or 2 weeks before school starts. So that's an opportunity as well for students. And then throughout the year, there's time where schools can take to make sure kids are on track, especially once we get them assessed with the assessments, because we haven't had them in person, so we haven't been able to assess them. And so once they're in person, we'll be able to get some really strong assessments, and I think that will give us some good information.
Thank you. Thank you, Councilor.
Thank you.
Yeah.
Thank you very much, Councilor Mejia. Thank you to the superintendent. We are open to doing a third round after public testimony. I do know that a few of the panelists do have to leave us, so I'd like to now move to public testimony. We have, I'm going to bring in, if we could, Megan Castro and Pamela Rose.
Madam Chair, I just want to let you know I have about 10 more minutes, and then I have to step off.
Thank you, Superintendent. Councilor Campbell, I'm
all set. I didn't realize you called me. I think I was grabbing water, so I'll give my time to public testimony. So thank you very much.
Thank you. I appreciate that, Councilor Campbell. So we're going to bring in, if we can, Megan Castro and Pamela Rose. Welcome. So Pamela, I see you. I don't see Megan Castro, so I'm going to start with you first. Welcome. Oh, I see you, Megan. I'm so sorry. I see you now. Go ahead, Megan. We'll start testimony with you first. Welcome.
Thank you, Madam Chair. My name is Megan Castro. I'm a parent of 3 elementary school students at BPS. Sorry, my kid's walking in because I've been here for 2 hours and 11 minutes. One sec, but I'm here today representing a group called Voices for BPS Families. We're a group of parents and guardians of BPS students who organically formed last fall to advocate for the reopening of in-person learning in Boston. There's no disputing the disturbing fact that remote learning is perpetuating inequities and leaving lots of the most vulnerable kids behind. Private schools, Catholic schools have continued to prioritize their students and give them what they needed most during this pandemic: safe, supportive, in-person learning for the entire year. Yet BPS has been closed. This is something that the leaders of Boston have not had as a priority. As Councilor Sabi George mentioned, the last time the City Council even had a meeting on this topic was last fall. I ask you, where have you been? Some councilors have been busy working in their own districts to help the schools in their districts, but as a body, you have had no voice in this. Thankfully, the state leaders have stepped in. We're grateful to Governor Baker and the Education Commissioner Riley for their work to get all kids in Massachusetts back to in-person school full time. Because of this, there has finally been movement in Boston to get public schools into school, public school kids into school for 2 days a week, and April 5th is the required start date for 5 days a week in Massachusetts. Trust us, the parents of Boston are thrilled along with the kids. Now BPS has filed a waiver. They say they need more time. For example, their waiver states they have lots of furniture to move. BPS has had 9 months to rearrange furniture. As the superintendent just mentioned, new windows, new air purifiers. Let's finally put these improvements to work 5 days a week. If needed, let's get the 400 salaried people who work at the BPS central office to help move some furniture tomorrow. What are we waiting for? Also, BPS has not told the parents that this waiver was filed. It was submitted at 5 o'clock yesterday. BPS sent their weekly email update to the entire BPS community just yesterday. There was no mention of this waiver. If a parent didn't read the Globe article that came out about the waiver late last night, they have not heard that their school district wants to push back this 5-day start for 3 more weeks. They did not know that they should be calling DESE to urge Commissioner Riley to deny the waiver. These parents have been left in the dark by the district. Parents do not need time to plan, as the superintendent said now. Parents are ready to start full-time on April 5th. We've been desperately waiting for a year. Our group has a petition to ask Commissioner Riley to deny this waiver. The petition already has over 800 signatures of Boston families. We plead with the City Council to support Commissioner Riley in denying this waiver. This is not about a negotiation or an injunction or hearings. It's about getting elementary school kids back to school full-time, 5 days a week, April 5th. No more delay. Thank you for your time.
Thank you very much, Megan. Pamela Rose, and anyone in the wait room, that's it for signed up, those who have signed up for public testimony. So if you are interested in signing up, please raise your hand and make sure that your full name is in on your identity there. Ms. Rose, welcome.
Hello. Thank you so much for having me. I'm here on behalf of the Parent Council at the Sarah Greenwood K-8 dual language school. We would like to take this moment to ask questions and lift up concerns about ensuring that the Bill BPS guiding principles of creating more equitable program placement and learning opportunities for our most vulnerable students, including students with special needs and English language learners, locating new or expanding buildings in neighborhoods with high student need and low current access, expanding access to quality learning environments for more students are lived up to and executed. At present, the BPS Ready plan does not address the longstanding inequality of a suitable learning environment for our students, particularly at the Greenwood, primarily in the area of Dorchester Grove Hall. The pandemic and the subsequent lack of transparency around the extremely poor building conditions of the Greenwood left many of us parents shocked and angered that the city has allowed this neglect to go on for so many years. I myself am a parent of a first grader and a soon-to-be K1er. And aside from the years of advocacy work that the staff and community have done to raise awareness around the poor issues at the Greenwood prior to the pandemic, for example, having more than one bathroom, the poor conditions in the outdoor play areas for students, the broken glass, needles, trash that render the play area space unsafe, and among several more issues. The most recent disclosure of asbestos and the excess of 90 broken windows has reignited the breadth and depth of the advocacy needed for our children. We appreciate the district's plan to maintain open windows and doors, to increase circulation for school like the Greenwood, which has steam heat without ventilation, no HVAC, the gym, no windows, cafeteria, no windows. However, this well-laid plan is not without consequence. Open doors pose safety risks for our children, and fans are not enough to provide adequate circulation of air. I myself have a child who suffers from asthma, and there are several other students at the Greenwood who suffer from complications that can be worsened by exposure to COVID. Any plans to hold outdoor learning spaces are also pose a risk to students due to the poor conditions of the facilities outside of the school. Now is as important a time as ever to re-examine which learners receive what all learners rightfully deserve. We just heard from families who want their children in school, who are ready to put their children back in school, but the parents at the Greenwood are severely concerned that the conditions at the Greenwood with regards to the facilities are not adequate for our students. At present, there are suitable vacant BPS-owned buildings and vacant spaces within other presently inhabited buildings that can improve both the health and learning outcomes for our children. We oppose any redistribution of funds for short, quick fixes at the Greenwood. We are asking that the BPS Ready plan includes plans to relocate the Greenwood to a location that provides our children with a safe, equitable, and suitable learning environment before any consideration is given to full in-person learning for September. It is evident, based on the schools listed by the superintendent that are currently being rebuilt or undergoing extensive renovations, that the communities with the most vulnerable populations and with the highest infrastructure needs were not a priority. They weren't a priority before COVID, and we are hoping that the issues that are highlighted by COVID will now force the district to take a look at what conditions we are forced to live under currently. Thank you.
Thank you, Pamela. Thanks for joining us. Next, we have Latoya Gale. Latoya, and then I'll bring Abdi in.
Hello, everyone. I just wanted to jump on and say that the biggest problem with reopening plans are parents were not included, especially parents of color, especially our working parents, especially our parents who are non-native English speakers. And these are the communities that have been impacted the most by COVID. These are the families whose family members have been sick with COVID, have died from COVID, and you didn't bother to ask any of us. As much as we all ideally would want to be in person, we want more than anything to be safe. Sick kids can't learn, sick family members can't make sure their children are learning. It's irresponsible, it's deadly, it's dangerous, and it's disrespectful that you did not ask us what we needed in this situation. You're gonna send our kids back to school for a short school day with no after school care? That doesn't help us. You're going to send this, the way you did this is traumatizing to our families, and it's not fair. And you need to reconsider it. And yeah, there are some families that want their kids to go back to school full-time right away. But guess what? There's just as many who don't want that, who want hybrid to remain on the table, who want their children to be safe at school. And you need to hear what our concerns are. That's all.
Thank you very much, LaToya. Abdi?
Thank you, Counselor, and thanks to LaToya for that powerful testimony. I echo everything LaToya said. I'm just going to be very quick. We know that the COVID infection rates are going across the country, 21 states, Massachusetts up there. And we also know that Europe is going through a lockdown, and we typically are behind 2 weeks. East Boston, where I live, is a working community. Like LaToya said, nobody actually talked to us. We were the most impacted COVID. We know this pain very close. We would love our kids to get back to school, but we could only go back to school when it's safe. We just went hybrid for all the students last week, and we already have 2 infection rates in our school. So it's absolutely, it's disrespectful that we are not being considered. It's dangerous that our lives are constantly put in danger. We have to always constantly battle and always fight back. We are exhausted fighting back. We were able to shut it down last time the school was going to reopen. And now again, we are here demanding the schools to be not reopen until safety protocols are in place. Our families are not vaccinated. Our kids are not vaccinated. Our teachers are not vaccinated. We are the most people who died from COVID. And we are asking you all to stop disrespecting us and finally, please listen to our voices. If we are saying we promoting equity in this process, and now equity become a very buzzword, but we're not being included in the discussion. How's that equitable to begin with? So we ask that you all consider the reopening. Pushing to April 26th is not going to help us. We would like the hybrid model to be in place, and we would like the remote model to be in place. Thank you for hosting this very important hearing, Counselor.
Thank you, Abdi, very much. And I do want to note that my understanding is the hybrid model will still be in place and still be an option. And certainly this shift is a big part of today's conversation around the waiver is due to the DESI mandate that's before the school district. Thank you for public testimony. I know there's some more questions perhaps from colleagues. Dr. Cassellius, I know you have to leave, but
I do. I just want to clarify too, Madam Chair, that hybrid is not an option. You can't come 2 days a week. It is 5 days a week or remote only. That's the state mandate.
Thank you for clarifying that.
Yes, but however, we are working on the attendance pieces of that with the commissioner and hoping that he'll provide some flexibility on that piece.
Great.
Thank you. Thank you, everybody, for having me. I'm sorry I have to leave.
That's fine. Thank you very much for staying with us this long. We still have members of the BPS team here. And I do have one additional question. I hope mine will be very brief. The presentation earlier, and I think, Mark, this was through your presentation, although it could have been through Megan's presentation around the current attendance rates for this current school year. I am curious, what does it mean to be present? Is that someone who is a child who is in all of their classes, or they've logged in once, or obviously if they're participating in hybrid, they've been in the classroom?
Yeah. So on our dashboard, you will see present broken out by remote as well as in person.
Mm-hmm.
Currently, the state defines present as meeting the structured learning time requirements. According to the state, you have to attend at least 50% of the day or more. Now, in the current state of situation where students are attending class, they're attending asynchronous learning, it is up to the teacher to determine whether or not the student has met that 50% or more requirement. We don't have a timer on things. We don't have a calculator that does that. So it's the teacher who's making that decision over whether or not they've met that requirement for the day or not. And that dashboard will break that out by in-person as well as remote. Moving forward, as Dr. Cassellius has mentioned, the state has originally said that if you are in person, then you will not be able to attend remotely. However, they did say that In situations involving COVID, if a student has been quarantined for any reason, then that is obviously an acceptable reason to switch over and attend remote classes while still being counted as present. So they're still kind of clarifying exactly what that language will look like when we do go back to 5 days. But they did want to say that there will be only 2 options, in-person or remote, except in extenuating circumstances in which a student or class may be quarantined and they need to pivot to remote learning.
Appreciate that. And thank you for that clarification. So I see that Councilor Mejia has her hand up. I won't go in order this time. If any colleagues have questions, please raise your hand and I'll come to you. Councilor Mejia.
Yes, I'm not sure if the person who was testifying here from the Greenwood is still on. I believe that her name was Pamela.
She was offering public testimony.
Okay, so she left. But I just kind of wanted to echo those sentiments in terms of just this cry to open up schools and to keep them closed, be or not to be. I think that there's some really deep inequity in terms of what your children go to school is what schools are prepared to be opened. And I think hearing LaToya's testimony, as well as some of the other parents, is that when we're thinking about the inequities and we're thinking about who is the most at risk, that should be what is driving this conversation in terms of whether we're ready to open or not, right? I think centering it on that is deeply important. And I kind of want to go back and reiterate the questions that I asked around parent voice and the process, because it still seems to me that parents, not all parents are being heard, or not all parents are having an opportunity to really share their concerns. So I'm really hoping that as we continue to have this conversation and as we continue moving forward in these discussions, that the district continues to do all of it that it can to ensure that parents are front and center of these conversations. And for those who know that I started off my education career as a parent activist. And one of the things that we also complained about was not feeling heard or seen. And it seems like that is still continuously to be the case. And I think that we have gotten to a place in a crossroad that we can't continue to do business as usual and expect parents to just be quiet. So I say all of this because I'm really hopeful that we'll find some common ground. But unless we're driving this conversation with those who are living the realities and or doing the work, which are educators and parents and families, then we're doing everybody a disservice. And I think that there needs to be space for all of us, because what I've heard tonight and what I've heard throughout the entire process is that educators and families continue to be disregarded. Not all, but some.
Thank you, Councilor Mejia. Fabienne, I see that your hand is up. Do you have a response or a comment to Councilor Mejia's question?
No, just a comment is just to echo of what LaToya mentioned, that a lot of the schools that they are pushing for open, no offense to no one, we do want the students to go back to school. But living in Mattapan, where the rate of kids with asthma are like much higher than in the north and in the south end, and the kids that have have other disabilities or issues that they may have, those parents are not being informed or being asked what will be working for them. It's the same that I'm questioning about the students and families who are homeless. How are we reaching out to them that they can answer those questions to say, okay, do they want to be in remote or in person? How are they pushing back? Because now they say like we have the survey until the 31st or the 30th. By the time that they get back to those kids, they're going to be end of April or beginning of May. So we only have like few more weeks before the school is closed. So I'm just wondering to see, is this being equitable to make sure that, they're serving all the students? And also those kids, the weather is getting warmer now. What is the plan BPS is providing for the students as the weather gets, they can be out? Is there PPE that's going to be providing for all the students? The mask, do we have all the support that the kids need on that? So I'm not too sure that, they are thinking about on a big picture for the district, or is it just thinking about just individual schools? Because if it's individual schools, kids in Dorchester, Mattapan, in those areas, they're not, the schools are not ready for that. And how to make sure that, you know, we're making all the students can go back to school. I'm thinking like they should be able to think about it in a bigger pictures and bring families and all the partners together. Let's get ready so we can be able to have a better plan for the summer and for the fall, because we only have like 2.5 weeks, 2.5 months left. It's by the time that things get worse, we have to close back again and come back to the table and having the same conversation again. I'm just saying that, you know, how this is being fair to the parents.
Thank you very much, Fabienne. Dana, I see your hand is up.
I just wanted to echo that I think that there are a lot of people that are very vocal, and so their opinions do get heard. And then there are other families that have just come to trust the school district that we're going to make the best decision possible, and that if we say it's safe, that it is safe. I've worked very hard as a white teacher working with primarily Black and brown students to get my parents to trust me. And if I say that the classroom is safe, then they believe me. But I work in a school that is very safe in comparison to a lot of the other ones. Our school doesn't look like the Sarah Greenwood. We have an HVAC system. We have windows that work. We have an outdoor play area that's safe. And so I think it's very, very important that we start talking to parents all over the district and allowing all the parents to have a bigger say in what's going on. I've heard a lot about hybrid learning being taken off the table as being a really hard thing for a lot of parents who have work commitments or can't pick their children up after school because of their own daily plans. So I think that it really is a problem that we're going to have to face a lot more, especially now that hybrid is being taken off the table and students can only go remote or in person.
Thank you very much, Dana. And do any of my colleagues have anything to say before we wrap up today's hearing?
Does that include those who are?
Let's go to Councilor Campbell, and then we'll go to final statements.
I'll just say, you know, thank you so much to the folks, the parents who waited to testify, you know, really important, really powerful. I was listening, of course, and we'll continue to do the work, mindful of their advocacy. And, you know, obviously we can always structure hearings in such a way that we give some top public testimony maybe towards the beginning. So thank you so much for holding the hearing, but thank you also to the families that showed up to testify.
Thank you, Councilor Campbell. Councilor Mejia, closing remarks.
Yes, thank you, Councilor Asabi George, for hosting us and keeping this conversation front and center. Really do appreciate your advocacy in this space. And I would have to echo Councilor Campbell's, you know, recommendations. I know it's really hard when we, especially for families who stayed as long as they did to be heard. I really do think that we have an opportunity to reimagine even some of our public hearings so that we can lead with the families and create an opportunity for the superintendent to hear directly from those who are dealing with these realities. I think that would just be something that I'd like to offer for us to consider, especially because there's going to be so many other hearings around budgets and all that other stuff. So I really would hope that we start thinking about ways we can structure it. And the last thing that I'd like to say is that, you know, I think that we need to be able to offer choices for all families. I think that this one or the other doesn't really work. And while I understand that's a state mandate, I think that as a district, we need to be able to stand for and support our families and provide as many options so that, because every family is uniquely different. People need different things. And I think having those choices are really important for people. This one or the other going back to school for 5 days or not is just, it's a lot. So thank you for convening, and thank you to all the advocates, the parents, the educators, and you, Councilor Asabi George, for all your work in this space.
Thank you very much, Councilor Mejia, and I do thank everyone as well. There's a number of questions and comments that I didn't get to, and I just want to summarize some of them here and just note for the public that I will send these questions over to the district as I'm looking for just additional information and want to know that we're able to support our families, support our teachers, and certainly support our kids as they are the ones that we are doing this work for. And, very curious about students who are logged into Zoom and doing school virtually. Are we watching to make sure that they are able to continually access that? Wi-Fi has come up in today's conversation, and access to the internet has come up in many conversations. Just want to make sure that we can do that, and also want to make sure that we appropriately are using our classroom cameras, and want to understand the success or challenges that we've had with those cameras in the classroom. We know that the simultaneous teaching and learning is challenging, and we've got work to do there to make sure that we are able to support our kids and their learning. I also want to know that we will continue, especially as some other districts are moving to reopen fully over the next couple of weeks, that we make sure that we are working with them and collaborating with them to learn about best practices. And of course, always, as was mentioned today by I think a number of the panelists, as well as parents who were tuned in, that our students' mental health, their social and emotional well-being needs to be a big part of what we're doing as students return to the classroom or as they remain remote and learning from home. I also see that I'm talking to a screen that no one is logged in. So I maybe feel the pain that a few of our teachers feel when students are not turning on their cameras during the classroom. So I will end today's hearing. I will recess today's hearing, and there'll certainly be more to come around the reopening of school as we get the waiver update from the state and continue our conversations with the school department, with parents, with our educators, and certainly keeping our students, our children across our city front of mind during these conversations and center to the decisions that are being made. Thank you, everyone. Have a nice evening.